Hi everyone. So before I start this video, I wanted to apologize for my voice and my stuffiness. I have a really bad cold, and it's been really rough for the last few days. But I wanted to make this video, and this video is going to be about the stitch and like the cerclage and why I am not getting the preventative cerclage. Because I have had so many people ask me, and I really, it's just easier to make this video and explain it rather than to answer like every single question. So yeah, I guess I'll just back up and tell you, first of all, most of you probably know what a cerclage is, but for those of you that don't, it is a stitch that is put into your cervix to keep it shut. And usually it's done if you've had like preterm births, or if your cervix is dilated super early. And so that is what a cerclage is. And there are two kinds. There's more than two kinds, but there is a preventative cerclage, which is done to prevent the preterm labor from happening, or not labor, because the cerclage wouldn't necessarily stop a labor, but it would stop you from dilating. So I think it's between 12 and 14 weeks, they would do a preventative cerclage. And then that's before you dilate. Now, if they do an emergency cerclage or a rescue cerclage, that would be done when they see a change in your cervix. And I think there definitely is a higher success rate with the preventative cerclage. So a lot of people do get those. So let me back up and tell you the reason why this is even an issue for me. If any of you don't know my story, we did lose a baby girl in 2016, and it was a preterm delivery at 22 weeks. And it was out of nowhere, and we didn't see it coming. And so that is why I've been told by people that I should get one, or asked if I'm going to get one. So a little history about myself. I'll try to make this short, but my first baby was 8.5 pounds, born at 38 weeks, no dilation whatsoever. Like beforehand, like my water broke and I was like less than a centimeter dilated. It took me 22 hours to deliver her. I pushed for like 3 hours and she finally came out. So that was my first one. My second one, who is 9.5 years younger than the first, was born at 40 weeks, had to be induced, 7 pounds 2 ounces, ended up with an emergency C-section because of issues with her, but the labor itself was 18 hours beforehand. And so when I got pregnant again, and there's a big age gap between all of my kids, because those two kids I was just talking about are 17 and 7 now. So my loss of Emerson happened in 2016, and we were not expecting, obviously, because I had never dilated or had a problem with preterm labor at all. And so what happened was, I'm going to try to they do measure your cervix with ultrasounds usually. They measured my cervix at my 20-week ultrasound with Emerson, and it was fine. So what they did find at my 20-week ultrasound was that they couldn't see where the cord was inserted into the placenta. I don't think it was a marginal cord insertion. I think it was I don't remember how to say it, velamentous, where it was inserted in the wrong spot. But they weren't 100% totally concerned. It wasn't a big deal because the baby was fine and the fluid was fine and my cervix was fine. So they also found a placental lake, which if you look that up, it's like a cyst on the placenta and it's fluid, I think. And that's not an issue usually, but they did say, I asked my doctor, because I was worried that day. I said, is that something you've seen before? And he said, well, yeah, but never that big. So he decided to send me to the maternal fetal specialist. He said that they would make an appointment for me for the next week to get what they, had to say about this. Well, the next week, and I hate to even admit this because this is one of my biggest regrets, the next week I couldn't go. They called me and they said, like, we want you to come in tomorrow, which may be like a Tuesday, I'm not sure. And I said, I can't like come that day because like everybody was off work. It was summer and I could not get off work. And I didn't think it was that big of a deal. I don't think anybody did. So I didn't go, and I rescheduled the appointment, and we didn't make it to that appointment. So what happened was, like I said, 20 weeks, the cervix was fine. So at 22 weeks exactly, in between those two, 20 and 22 weeks, I did have very thick cervical mucus that looked like a mucus plug. It was hard. It was not normal, like cervical mucus that it was, and I remember thinking that was weird. And I also had a lot of like large fluid spots in my underwear at times, and there was some other signs. It's all like, honestly, I have pushed a lot of that out of my mind, but I do believe there was signs that I was going into labor. But I ignored them because I just didn't think that I was. So yes, at 22 weeks, I was sitting on my porch and I felt it sound, I can almost hear it like that. And it was my amniotic. When I checked, I put my finger in to see what it was, and I could feel a bulge, and I rushed to the hospital, and it was the baby's amniotic sac, and the rest is history. She was alive up until about an hour before she was born, and they induced me after that to get her out. And the reason that she passed away in there before she was born or anything, because they were going to try to like keep me, pregnant if they could, even though my water did end up breaking. The reason that she passed away was because her placenta detached from my uterus. So anyway, when they did the testing, I did not let them do an autopsy on her, but the placenta did show a really, chorioamnionitis, which is a infection. So the baby did have an infection. The amniotic sac had an infection, and they basically, you don't know if the infection causes the cervix to dilate or the cervix dilates and lets infection in. So of course, before I got pregnant this time, I'm sitting there saying, well, I'm definitely going to get a stitch because I don't want this to ever happen to me again. So when I got pregnant, and that took a while, obviously, for those of you who follow me, you know that. So, feelings change. You get a little more like trying to be more like realistic, like think, okay, maybe I should listen to the doctor before I demand a stitch. Well, I went to the MFM. They set up an appointment for me, and like you probably know, they decided to not do the stitch right now, to not do a preventative stitch, because he said, I think 70% of his patients that have a situation like mine won't need the stitch. They do think there was some markers there that show that the pregnancy wasn't completely normal, that like because of the cord insertion and the big lakes on the placenta, that there might have been something going on there that would not have been viable. So, am I taking a risk by not getting a stitch? I don't know. I don't feel like I am, because they are going to do progesterone shots every week, and they will be doing cervical ultrasounds every week. And honestly, for somebody that had an infection it's not always wise to do, because you do take risks when you do. I guess basically, like, my cervix is so long right now, it's like longer than like an average like one that on a pregnant woman, and they just, they don't want to do a stitch and like risk more infection or anything else if it's not necessary. And I know that you can have full-term babies and then end up with an incompetent cervix, but they don't believe that I have an incompetent cervix. I do trust my doctors. I know a lot of people will probably think I'm crazy, but I really do trust them to make the best decision for me. I don't think they want my baby to die. I think they see this a whole lot more than I do. I trust that they will take care of me, and I pray to God that my cervix does not start dilating, but if it does, I believe they will catch it. And so yeah, I mean, I don't know, like, I don't feel like I need to explain myself, and I'm not like doing this to be, I'm just making the video because people were asking if I was going to get a stitch or telling me that I should get a stitch. And my situation isn't, okay, I know, like I said, I know you can have full-term babies and then need a stitch, but like if this had been my first baby, I don't know, there's a lot of things. This was more like a preterm. It was PPROM is what they put it down as, which is premature rupture of membranes. And it did happen very quickly, which I know incompetent cervix can show very quickly. But I honestly, I feel comfortable with this decision. I wasn't sure at first. I definitely feel comfortable with it now. And I hope and pray that I'm making the best decision. My doctors, I don't know, you guys probably don't know my area, but for those of you who do, I am a Hurley patient. They are from Hurley. They are a very, very good hospital. They're very good MFMs. I trust them. But I mean, of course, there are times that I second guess it, but I believe I'm making the right decision. For me to like just go in and like, I don't know, I trust it. So I will, like I said, I will be having I'm more concerned with having the progesterone shots. I think that may help me out. My other doctor actually did tell me that they do not do the stitch as much as they used to because progesterone shots do tend to sometimes keep the cervix longer as well. So anyway, I guess that's all I really want to say. So that's why I'm not getting a stitch, and I hope you guys can respect that, that's my decision and was my doctor's recommendation and decision. And, they are the medical professionals, like not me and not anyone else. So I'm just going to go with that. But, yeah, so I hope that explained it a little, and I will talk to you guys later.